Donald Trump now just a few days from being back in the White House, and so the fear mongers come out, the propagandists, those who want you to be scared and hide in your house and wear masks and keep your kids home from school. All those folks are coming back out like the plague that they are, while warning us about a plague that, well, I haven't seen yet. Dr. Peter McCullough joins me. He's the Chief Scientific Officer with the Wellness Company. He's with me now. Doctor, nice to see you again.
Thank you.
Let's start with this. Health experts, and I use that term lightly because I don't know what a health expert is anymore. I consider you to be one, but some of these others, sir, I don't know so much. Talking about this quademic, flu, COVID, RSV, norovirus, man, they just want to throw it all at us. They just want us to dig a big hole and go hide in it. It's remarkable.
Stephen, most studies co-infection with two or more viruses is very rare. It's less than 1% of the time. It can happen. The bottom line is, a lot of our defenses that we use, nasal sprays and gargles, they work against all the viruses. Dilute to povidone iodine. Wellness Company features immune mist. Xylitol products are fine. So these nasal sprays and gargles twice a day are the first defense against quademic, not taking multiple vaccines.
Right. Let me talk about vaccines for a moment. I read on X, actually, here just a short while ago. Dr. Patrick Soon-Shiong, he owns the Los Angeles Times newspaper. He's also a renowned transplant surgeon. He says he's seeing more cancers, devastating cancers. A 10-year-old child with colon cancer, a 13-year-old child that died of metastatic pancreatic cancer, things that he never saw before. And he is tying those directly to the COVID vaccine. I mean, these are the things that you've talked about for a long time. Here are renowned healthcare professionals, best in their field, saying, look, there's a problem here. What do you say?
We simply don't know what's behind this observation that certain cancers are rising and becoming more aggressive. But clearly, there's enough concern that our CDC should work with the cancer registries and merge the vaccine administration data with the cancer data. The government holds these important sources of information, and the vaccine data should be stratified according to 1, 2, 3, 4, how many doses of the vaccine have been received. There have been multiple papers published showing the vaccines mechanistically could cause or accelerate cancer. It's up to our government agencies to investigate.
Can you see any reason, doctor? Can you see any reason at this point that you would take the flu vaccine, the COVID vaccine, any of these vaccines? What would you recommend any of them at this point?
For healthy adults, I wouldn't recommend any of these vaccines. They're sufficiently ineffective. And sadly, if there are side effects, it's irreparable. You can't take the vaccine out of your body after one receives one of these vaccines. But let's say somebody with oxygen-dependent lung disease, could go down with influenza or respiratory syncytial virus. It's possible that there could be enough benefit to take the vaccine to overcome these side effects. But otherwise, we should allow natural immunity and then our ability to defend these infections against these infections with nasal sprays and gargles really be the first line approach.
I hear doctors, not just yourself, but others now, in larger numbers and louder numbers, if you will, saying they support Robert F. Kennedy Jr. to be in charge of Health and Human Services because they say he knows more about the vaccines because of his intense studies than a lot of the doctors that are saying you should get a vaccine. Are you hopeful that Bobby Kennedy can change the atmosphere, if you will?
Yeah, I think he's on a good path for confirmation. We learned that this list of 17,000 doctors who were opposing him, and there's 1 million doctors out there, so 17,000 isn't much. It turns out that was stirred up by big pharma, and so it wasn't a legitimate, indicator of physician sentiment out there. Kennedy has a strong knowledge base, no doubt about it. But what he's really going to be looked to is to show leadership over these giant organizations to root out corruption and then take constructive steps to return healthcare freedom to the public and certainly provide drug and vaccine product safety to Americans, which we deserve.
Yeah, let me ask you before we run out of time here. If not the vaccines, and if we get Robert F. Kennedy Jr. in there, we'll probably have less vaccines. That'd be my guess. What are the alternatives? What do you do to stay healthy when it's cold and flu season?
The nasal sprays and gargles are absolutely key. Wellness Company features Immune Mist, which is dilute povidone, iodine, and saline. Xylitol products, Clear is the lead brand name. These are fine. They must be used twice a day. A companion gargle like Spry, Scope, or Listerine is the only way to stay free of these illnesses. I've interviewed so many people for my show. The only people who go a year without getting a cold are doing nasal sprays and gargles twice a day.
I mean, that's because the virus replicates in the nasal cavity, right? That's the science of it.
Right. It's up there for about 5 days before you ever feel a symptom. That's the reason why you have to do it every day, kind of knock down that viral load so your immune system fights it off.
Wouldn't that have worked during COVID? Wouldn't that have been the key as opposed to what we did?
There was a randomized trial, large one by Baumforth and colleagues with xylitol-based products. It was better than a vaccine. Nasal sprays and gargles are better than vaccines. They're harmless, and everybody should be doing it.
Everybody should be doing it. Dr. Peter McCullough, he is the Chief Scientific Officer at the Wellness Company. You can find out more at twc.health/Gruber. Save 10% on anything you do there. They've got prescriptions. They've got supplements, especially for the spike protein, which, Doctor, you say is the very best. Tell me about that real quick.
Ultimate Spike Detox, best-in-class product, is a combination product, enables the body to help clear the spike protein and recover from long COVID and vaccine syndrome.
And I take it. I know a lot of people that take it. I recommend it for whatever that's worth. Dr. Peter McCullough, always appreciate you being here, sir. Thank you.
Thank you.